In this video, I will give you some information on cardiac sonography programs and certifications. Most cardiac sonography programs are 2 years long that lead to an associate's degree. Check local community colleges to see if they have a program. Community colleges are usually a lot cheaper, with programs ranging from $10,000 to $15,000 for the entire program, but are usually more competitive to get accepted into. On the other hand, private colleges are usually more expensive, costing up to $50,000, but will accept almost any student. So you need to decide whether it's worth it to you to spend time trying to get accepted to a cheaper program or spend extra money and start right away. From my experience, hospitals do not care what school you went to as long as you have one of the 2 main certifications, which we will get into later. There are some colleges that offer certificates in cardiac sonography, meaning at the end you will not earn a degree. The major benefit of these programs is they can be as short as 12 months in length, but there are very few programs out there. Check your area if there is one nearby. I personally completed one of these programs to start my career, and it's a good option. The next important thing you need to ask any college before attending is whether their program allows you to take the certification test for one or both of the major certifications. The 2 certifications you need to become a cardiac sonographer are ARDMS and CCI. To clarify, you only need one of the 2. The first one we'll go over is ARDMS. This stands for American Registry for Diagnostic Medical Sonography. The most important thing you need to know about this certification is that it will require you to take 2 separate exams, the physics exam and the cardiac sonography exam. From talking with co-workers at different hospitals, most people feel that the ARDMS exams are more difficult compared to CCI. However, another important thing to keep in mind is that a few of the larger hospitals in Southern California, like Kaiser and UCLA, possibly more, are requiring certification from ARDMS specifically. So check job listings in your area to see if hospitals are following this trend. The other certification we'll go over is CCI. This stands for Cardiovascular Credentialing International. There are 2 important things you need to know about this certification. The first is that smaller and cheaper programs tend to gear their program towards meeting the requirements for this certification. This is because the accreditation for the school to provide this program for students itself is cheaper for the school. And also, CCI offers a pathway for students to get certified, even if they attended an unaccredited program. This is also the reason why programs that meet the requirements for ARDMS are much more expensive, because accreditation for the schools are more expensive. The second thing you need to know about CCI is that there is only one exam required for certification. The physics portion is incorporated into the cardiac sonography exam. Also, again from talking with coworkers, the consensus is that the CCI exam is easier than ARDMS. So think about these factors when choosing a program to attend. Next, I have a couple of important tips to consider that will save you a ton of time and money. But before we get into that, if you found any of this helpful, please like and subscribe because it helps out the channel big time. One tip I would recommend is not attending a bachelor's degree program for cardiac sonography. These programs are up to 4 years long and more expensive, but with little to no benefit. Again, most hospitals do not care what school you went to or what degree you got. The only thing that matters is the certification and experience. So save yourself some time and money and avoid these programs. Another tip I can offer is look into online accelerated courses for prerequisites for cardiac sonography programs. Some of the prerequisites include college-level general education like English and college algebra. One online college I went to finish prerequisites, fast and cheap, was Straighterline, but check online for other similar programs. Some of these courses can literally be completed in 1 week, but be sure to check with the cardiac sonography program you're in to see if they accept these courses. If you decide to go ahead and enroll, watch this video on how I passed my cardiac sonography program with straight A's, studying only 1 hour a day,